information how and where. That one is the characteristic of analytical in epidemiology, which means analytical epidemiology. It involves especially just all about these questions. And so the next one is as noun. As noun by itself. So the science of disease methods, and so it is a science of an acquired science, which means the research science. That one is so in epidemiology has the methodology just to determine and the study of the natural history of the disease, and so identify the association and so potential etiology or cause of the disease, and so the risk factor for the disease, and so evaluate the new preventive. Evaluate the new preventive and the therapeutic measure, especially in the so many new modes of the healthy care delivery, which means especially here is so all about the evaluate new preventive in the so therapeutic measure. Just here is what are the health related, and so what means the disease all about, and so is the next ones. Just as we say from the beginning or from the very beginning of the definition of epidemiology is a science of solving a problem. So just as first there is thinking, which means assess needs. Then after we tend to find the problem, then fix problems. After you fix problem, just you tend to all about the step of the inquiry ones from the very beginning of data collection with may it is the matter of surveillance, may with the determined ones, which means the factor, or in pattern. The pattern one is so may place a person in the so time. After data collect, just we assess all about our data you on your hand. That one is assessment. Then after assessment, you tend to hypothesis test, which means to get your alternative. Then after you begin to the action ones. And so here is all about by public health approach by solving problem systems, which means from the very beginning of the step, assess need, find problem, fix problem. Then data collect with surveillance to the last of action. Just here is the surveillance ones. In surveillance, just you see what is the problem. What's the problem? And so the risk factors are the risk factor identify or risk factor identification, which means what is the cause. And so in the intervention or evaluation, what works. And so in the last implementation one is how do you do it. And so after you get the problem, just here is the response once. In epidemiology, you see, in epidemiology, the public health issue or the public health systemic of epidemiology from the very beginning of the vision, or in public health as epidemiologists, the vision one is, or the vision of epidemiology is as first healthy people in healthy community. Just as mentioned, just promote the physical and the mental health, and so all about from the very beginning of prevent disease to the last of the achievement or the mechanism of achievement, which means just by foundations public policy and so or by here all about the achievement was. And so the next one is the essential service in epidemiology. What are the essential service in epidemiology? What are the essential service in epidemiology? Just inform, educate, and inform the people about the health issue. Which means information means may just in some science, in just like pharmacy, DIC drug center or telemedicine is all about information, just or by inquiry or by data collect, just by gathering information. Just that one is one of the information. So you must inform to community and your patient or your student or on the practitioner ones, whatever it is in the staff. And so the next one is educate, which means we can categorize educate ones in some three parts, which means patient education, health education. So may all about the practitioner part. And so impart the people about the health issue. The mobilize the community partnership to identify, solve health problem. As epidemiology is the science of solving health problem, just to identify and solve health problems. The next one is in epidemiology, social service of epidemiological public health. Just that one is develop policy and so plans that support health efforts and so enforce the law and the regulation that protect health and ensure the safety. And so the next one is so link people to personal health service and assure the provision of the health. And so the last one is the next one is assure competency in public health and so healthcare workforce. And so as a last research, but before that, evaluate effectiveness and accessibility. Even if with the quality of the service in the healthcare or in the academic area or the tertiary hospital or in the practitioner, even if on your student or at everything, just quality of the service. And the last one is research for new insights and innovative solution to health problems. Innovate. This one is research for new insight and innovative solution to the health problems. So here is the next one is the public health approach. In epidemiology, the importance of epidemiology we can categorize in clinical and so in community or in public or in epidemiology. The same is true as approach. Here is one of the importance of epidemiology. The public health approach of the epidemiology is in public model or medical model. The public model once is in community, and so the medical model is just individual patient. Just like you can determine or identify in genetics, behavioral, social, and so healthcare. All about here is the genetics, behavioral, social, environmental, and personal healthcare, and the personal healthcare. And so just is one of the achievement systems. And so the term read it or term of the epidemiology or the key term of the epidemiology from the very beginning of epidemic or cluster, endemic, and so pandemic with the race. The key term in epidemiology, especially on the basic measurement of epidemiology, especially disease frequency measurement in epidemiology. Just so here is all about introduction to epidemiology.